So, you've been there, right? You walk out of the doctor's office, you've got that prescription in your hand, and you feel like, okay, problem solved. But what if I told you the most important part of that medicine isn't the actual pill, but the thinking that happened before that paper was ever printed?
Come on, be honest. You're feeling absolutely awful. You've got a really nasty cold, and you just want it to be over. It is so tempting to think, you know what, maybe an antibiotic would just knock this thing out. It feels like the strong, fast solution.
But that one seemingly tiny choice, well, it's like the first domino in a much bigger, much more complicated chain reaction. It's actually at the very heart of a huge challenge that healthcare systems all over the world are facing every single day.
And it really gets you thinking about one of the core questions of modern medicine. Do we really have a pill for every single problem? I mean, we have incredibly powerful medicines, no doubt about it. But their real power isn't just what they do, it's how they're used. And getting that part right, well, that's the absolute gold standard.
And you know what? That gold standard actually has a name. It's called the rational use of medicine. And this isn't just some fuzzy idea. It's a really clear, systematic approach to making sure every single prescription is the absolute best choice for you, for the illness, and for everyone else.
So here it is, the official definition straight from the World Health Organization. And I want you to notice something here. It's not just about getting the right drug. It's about the right dose, for the right amount of time, and, this is a big one, at the lowest possible cost. Not just for you, but for your whole community. It's a completely holistic way of looking at treatment.
We can actually break this down into a super simple checklist. A lot of people call it the rights of medication. It means the medicine is for the right reason, it's the right drug for you as a specific person, you're getting the right amount of it, through the right method, like a pill instead of a shot if that works, and you're taking it for the right length of time. Every single one of those has to be right on the money.
So how does the doctor actually pull this off? How do they make sure all those rights are being met? Well, it's definitely not guesswork. It's a very deliberate, step-by-step process that starts way before a prescription pad is even touched.
And this process is incredibly logical when you look at it. First, a doctor has to clearly define the problem. Then, they set a goal. Like, are we trying to cure an infection completely, or are we just managing the symptoms to make you feel better? Only after that do they select a treatment, write out the script, explain everything to the patient, and finally, check in to see how it's all going.
Now, deep inside that third step, select the best treatment, there's a really neat little framework that prescribers often use. It's called the STEP criteria. They have to weigh the S, safety of the drug, the T, tolerability, like can your body actually handle it without bad side effects, the E, efficacy, is it actually going to work, and finally the P, price. It's a super powerful way to make the smartest choice.
And when you see it laid out like this, the difference is it's night and day. Rational use is a doctor prescribing a specific antibiotic because you have a confirmed bacterial infection. Irrational use, that's taking that exact same antibiotic for a viral cold, where it's going to do absolutely nothing. Rational use follows a real diagnosis. Irrational use is, grabbing some leftover pills from a friend. Okay, so we've seen how this works for one person and one prescription. But what happens when we zoom out? What happens when these little mistakes are made millions and millions of times a day all around the world? Well, the consequences aren't just personal anymore. They're global, and they are serious.
The first one, and honestly, this is the one that really keeps scientists up at night, is antimicrobial resistance. You see, every single time an antibiotic is used when it's not needed, it's like giving bacteria a free training session on how to beat it. This is exactly how we end up with superbugs, these terrifying infections that our best medicines just can't touch anymore.
And then, of course, there are the adverse drug reactions. Using the wrong drug, or the wrong dose, or just way too many drugs at once, it can cause real physical harm. This leads to more hospital visits, a lot more suffering, and sometimes much, much worse outcomes. It's not just that it's useless, it can be genuinely dangerous.
And yep, you guessed it, there's the money. We're talking about massive economic waste. Every unnecessary prescription, every time a super expensive drug is used when a cheaper one would work just as well, it all adds up to billions of dollars. That's money that could be going into research, or better hospitals, or crucial public health programs.
And finally, and this one is so important, when a treatment doesn't work or it actually causes harm because it was used irrationally, it starts to wear away at our trust. We start to lose confidence in our doctors, in the whole healthcare system. And that can make people afraid to get help even when they desperately need it.
So you see, the rational use of medicine isn't just the doctor's job. It's on us too, as patients. We have such a vital role to play. It's about becoming a partner in our own healthcare. So maybe the next time you're handed a prescription, just pause and ask a simple question. It could be, why this medicine in particular? Or what's our main goal with this treatment? Because being an informed patient, that's the first step in making sure every prescription is not just the pill, but the absolute right plan.